Did you know arthritis affects millions worldwide? But it's not just one condition. It's an umbrella term that covers over 100 different diseases and conditions. And while it's most commonly associated with older adults, arthritis doesn't discriminate. It can strike anyone at any age from all walks of life. It's a global health concern that spans across ages, genders and races, causing pain and disability in its wake. But what exactly is arthritis? What triggers its onset and how does it affect the body? More importantly, how can one navigate life while managing the challenges it presents? Over the next 20 minutes, we'll be peeling back the layers of this complex issue. We'll explore the various types of arthritis, delve into their unique causes, and examine their impact on the human body. Stay tuned as we delve into the different types of arthritis, their causes, and how they impact lives. Arthritis, in its simplest terms, is a condition that affects the joints, causing pain and stiffness. Now you may be wondering, what exactly is a joint? Well, it's the point where two bones meet, and they're essential for all the movements our bodies make. So when we talk about arthritis, we're referring to a range of conditions that cause inflammation and damage to the joints. This inflammation can result in redness, warmth, swelling and pain within the joint. And it's this discomfort that is a hallmark of arthritis. Arthritis is not a singular disease. In fact, there are over 100 different types, each with its own specific causes and symptoms. But the common thread tying them all together is that they all affect the joints in some way. Now, you might think that arthritis is a condition that only affects the elderly. While it's true that the risk of developing arthritis increases with age, arthritis can strike at any age, even in children. So, what happens when arthritis strikes? Well, the inflammation caused by arthritis can lead to a breakdown of cartilage, the hard, slippery tissue that covers the ends of bones where they form a joint. Without the normal amount of cartilage, the bones rub together, causing pain, swelling and stiffness. Over time, the joint can lose its normal shape and the bone can be damaged. It's important to remember that arthritis is more than just wear and tear or an inevitable part of getting older. It's a complex condition with many types and causes, which we'll delve into in the next segment. So, why should we care about arthritis? Because it affects millions of people worldwide, causing not only physical pain, but also impacting quality of life. Arthritis can make it harder to do many everyday activities, things we often take for granted like walking, climbing stairs, or even opening a jar. Now that you know what arthritis is, let's explore the different types. There are several types of arthritis, each with its unique characteristics. Diving right in, we have osteoarthritis, often referred to as the wear and tear arthritis. This is the most common form, affecting millions globally. The cartilage that cushions the joints wears down over time, leading to bone rubbing on bone, causing pain, stiffness, and sometimes even loss of movement. It typically affects the knees, hips, and hands, and often sets in with age. Next up, we have rheumatoid arthritis, an autoimmune disease where the body's immune system mistakes the lining of the joints as foreign and attacks it. This causes inflammation, swelling, and pain, especially in the hands, wrists, and feet. Unlike osteoarthritis, the onset of rheumatoid arthritis can occur at any age, and it often affects multiple joints symmetrically. Now let's talk about psoriatic arthritis, which is associated with the skin condition psoriasis. It's also an autoimmune disease, causing inflammation in the joints and overproduction of skin cells. It can affect any joint in the body, and its severity can vary significantly. Some people experience mild symptoms with occasional flare-ups, while others have continuous joint discomfort. Finally, we come to gout, a type of inflammatory arthritis caused by high levels of uric acid in the blood. These excess levels can lead to the formation of urate crystals in the joints, particularly at the base of the big toe, causing intense pain and swelling. Gout attacks can be sudden and severe, often waking you up in the middle of the night with the sensation that your big toe is on fire. Each of these types of arthritis has unique features, such as the affected areas, severity of symptoms, and progression rate. For instance, osteoarthritis is a slow-progressing disease that gradually worsens over time, while rheumatoid arthritis can cause rapid and severe joint damage within the first 2 years, if not appropriately managed. Psoriatic arthritis, on the other hand, can be mild or severe, and it can progress over time or remain stable for years. Gout usually presents as sudden, severe attacks that subside after a few days or weeks, but if untreated, it can lead to chronic gout with joint damage and pain. It's important to remember that arthritis is not a one-size-fits-all condition. The experience of arthritis can vary greatly from person to person, not just between the different types of arthritis, but also within the same type. The key to managing arthritis effectively is understanding the specific type and its unique characteristics. Now that we've identified the different types of arthritis, let's look at what causes them. Like many health conditions, the causes of arthritis are multifaceted. When we think about arthritis, it's important to consider that there isn't just a single cause. Each type of arthritis has its own unique triggers and risk factors. Let's start with osteoarthritis, which is often referred to as a wear and tear disease. You see, our joints are like the hinges on a door, and just as a heavily used door hinge can wear out, so too can our joints. This wear and tear can lead to the breakdown of the protective cartilage that cushions the ends of your bones, resulting in osteoarthritis. Age is a significant risk factor here. The older you get, the more mileage your joints have, and the greater the wear and tear. Next, we have rheumatoid arthritis, an autoimmune condition where the body's immune system mistakenly attacks its own tissues, specifically the synovium, a soft tissue in your joints that produces a fluid that nourishes the cartilage and lubricates the joints. But why does this happen? Well, it's believed to be a combination of genetics and environmental factors. Some people have genes that make them more susceptible to environmental factors like certain viruses and bacteria, which may trigger the disease. Then there's psoriatic arthritis, another autoimmune disorder brought on by the immune system attacking healthy cells and tissue. This type of arthritis occurs in people with psoriasis, a skin condition that causes cells to build up rapidly on the skin's surface, forming scales and red patches. The exact cause is unknown, but it's thought to involve a combination of genetic, immune, and environmental factors. Last but not least is gout, a type of arthritis characterized by sudden, severe attacks of pain, swelling, redness, and tenderness in the joints. This condition is caused by an excess of uric acid in the bloodstream. The body produces uric acid when it breaks down purines, substances found in your body and in foods like organ meats, anchovies, and mushrooms. When there's too much uric acid, it can form hard crystals in the joints, causing inflammation and pain. Now, let's not forget the role of lifestyle factors. Obesity, for example, can increase the risk of developing arthritis. Extra weight puts additional pressure on joints, particularly your knees, hips, and spine. Smoking, a sedentary lifestyle, and poor diet can also contribute to the development of some types of arthritis or exacerbate the symptoms of existing conditions. Understanding the causes of arthritis is crucial, but recognizing the symptoms is equally important. So stay tuned as we delve into the symptoms and progression of arthritis in the next scene. Arthritis symptoms vary but share some common characteristics. Whether you're dealing with osteoarthritis, rheumatoid arthritis, psoriatic arthritis, or gout, there are a few telltale signs that may indicate the presence of these conditions. Firstly, pain is a significant symptom of arthritis. It's usually localized around the affected joint and can range from a dull ache to a sharp, intense pain. The pain is often worse after periods of inactivity or toward the end of the day. Secondly, there's often swelling around the affected joint. This is due to inflammation, which is the body's response to injury or disease. The swelling can cause the joint to appear larger or misshapen and can make movement difficult. Next, we have stiffness, a common complaint amongst arthritis sufferers. The joints may feel tight, especially in the morning or after periods of inactivity. This can affect the range of motion in the joint and can make simple tasks like buttoning a shirt or opening a jar challenging. Lastly, many people with arthritis notice a reduction in their range of motion. This means they may not be able to move the affected joint as freely as they once could. Over time, this lack of movement can lead to muscle weakness and further limit mobility. The progression of these symptoms can vary widely between individuals and the type of arthritis they have. For example, symptoms of osteoarthritis typically develop slowly over many years, while those of rheumatoid arthritis may progress more quickly. Regardless of the type, it's important to remember that arthritis is not a static condition. It can vary in severity from day to day, and the progression can be influenced by many factors, including activity levels, diet, and even the weather. In terms of severity, arthritis can be graded on a scale from mild to severe. Mild arthritis might cause slight discomfort, moderate arthritis can interfere with daily activities, and severe arthritis can be debilitating, causing significant pain and disability. Recognizing the symptoms of arthritis is the first step towards management, which brings us to the treatment options available. Managing arthritis involves a combination of medication, exercise, and stress management. Addressing arthritis is not a one-size-fits-all approach. It's a personalized plan that revolves around the individual and their unique type of arthritis. Medication is often the first line of defense against arthritis. Non-steroidal anti-inflammatory drugs, or NSAIDs, are frequently prescribed to reduce inflammation and alleviate pain. For conditions like rheumatoid arthritis, disease-modifying anti-rheumatic drugs, or DMARDs, are used to slow the disease's progression and prevent joint damage. But pills are only part of the picture. Exercise plays a crucial role in managing arthritis. Regular physical activity helps maintain joint flexibility, strengthens the muscles around the joints, and improves overall well-being. It might seem counterintuitive to move when you're in pain, but the right kind of movement can make a significant difference. This is where physical therapy comes in. Therapists can guide you through exercises that are safe and beneficial for your specific type of arthritis. Stress management is another crucial component. Chronic stress can increase inflammation, leading to more pain and stiffness. So, learning to manage stress effectively is vital. This can be achieved through a variety of techniques such as deep breathing, meditation, yoga, or any activity that brings you joy and relaxation. Lifestyle modifications also come into play. Small changes like maintaining a healthy weight, eating a balanced diet rich in anti-inflammatory foods, and quitting smoking can have a substantial impact on managing arthritis. Remember, every individual's journey with arthritis is unique. What works for one person may not work for another. It's about finding the right balance of medication, exercise, and stress management techniques that work for you. Collaborating with your healthcare team, including doctors, physical therapists, and even dietitians, will ensure you're taking a comprehensive and effective approach to managing your arthritis. Understanding these treatments can help manage arthritis effectively. Scene script. Arthritis is a common condition, but with understanding and proactive management, it doesn't have to control your life. Throughout this discussion, we've unraveled the complexities of arthritis, a condition that affects millions worldwide, yet remains misunderstood by many. We've explored the different types of arthritis, including osteoarthritis, rheumatoid arthritis, psoriatic arthritis, and gout, each with its unique features, causes, and implications. We've delved into the causes and etiologies of these conditions, unmasking the role of genetic factors, lifestyle habits, and even age. We've outlined the common symptoms, from pain and swelling to reduced range of motion, and the ways they can progressively impact daily life. But we've also underscored the power of proactive management in altering the course of these conditions. From NSAIDs and DMARDs to lifestyle modifications, physical therapy, and stress reduction, there are numerous strategies at our disposal to combat arthritis and its effects. Remember, knowledge is power. Understanding the types, causes, and progression of arthritis empowers us to take control, seek the right treatments, and make the necessary lifestyle changes. It allows us to be proactive rather than reactive in our health management. But it's not just about managing physical symptoms. Arthritis can also take a toll on the mind, making stress management and mental health equally important. Incorporating techniques such as mindfulness, meditation, or simply finding joy in daily activities can go a long way in improving overall quality of life. As the Buddhist proverb says, pain is inevitable, suffering is optional. We can't always control the onset of conditions like arthritis, but we can control how we respond to them. Let's choose to respond with knowledge, understanding, and resilience. And as William James once said, the greatest discovery of my generation is that a human being can alter his life by altering his attitudes. Let's embrace this discovery and alter our attitudes towards arthritis, transforming it from a debilitating condition to a manageable challenge. Remember, Pain is inevitable, but suffering is optional. For more insights into understanding and conquering health challenges, don't forget to like, share, and subscribe to our channel, to our